So
Yes,
thank you.
Michael. Yes.
So thank you. I have to lodge a protest because here I am facing a bunch of excellent physicians coming from countries that play cricket. And though I was competitive with a bat, baseball doesn't translate well into the cricket forum. So I have two cases, and you'll see that mine are just a little bit different from what Richard has presented and what Timothy has presented. And we're each focusing on sort of different qualities that we see with aflibercept 8 milligrams. And mine focuses more on durability of patients that are already reasonable responders. The first is a 52-year-old male. This is a physician's assistant. So he's very knowledgeable regarding this disease, and despite the fact that he has an A1C of 7.5, he's generally a very compliant patient. Furthermore, his wife is the former chairman of our emergency room department. So he recognizes that if he doesn't do things properly, he's going to go home and he's going to get a lot of grief from his wife. So for that reason, he really comes across as a very, very good patient. At baseline, when I first saw him, you can see centrally here is 2050 with significant intraretinal edema as well as subretinal fluid. And it started him on aflibercept 2 milligrams, and he responded beautifully. He dried up very quickly at 4 weeks. I extended him out. We go to 6 weeks. He's doing really well. And then every time he went to 7 weeks, and this happened 3 times over the course of several years, his fluid came back. And when the fluid came back, the visual acuity began to drop. And these were sometimes planned, but sometimes because of my travel or his inability to get to the clinic. But we figured out that 6 weeks did very well. So we treated him at 4 to 6 week intervals because that's what seemed to work with respect to his treatment and our schedules. Finally, I had 8 milligrams available, and I said, well, maybe we can try something just a little bit different here, and maybe we can extend you beyond that 6-week ceiling that we seem to have hit. And so I decided on a strategy that I would never use for the majority of my patients, but I used for him. I said, we're going to give you 1 injection, and then I'm going to bring you back in 6 weeks and see what happens. And you can see at 6 weeks, he's 20/20. Not surprisingly, it looks good. I said, come back next week. Now we have 7. Next week, 8, 9, and finally at 10 weeks, he begins to develop a little bit of recurrent edema, and his vision begins to drop slightly. So I figured out 9 weeks after the first aflibercept 8 milligram injection is probably where he goes, and so I continue him on 9-week intervals with aflibercept 8 milligrams, and we've done that very nicely now. So this is one of those we talked about shifting the curve earlier on in my talk, where I said those patients who require frequent injections can be extended. If they're doing well, they can be extended. He's not going to get to 24 weeks, but he does get 50% increase in the interval after single injections. So he's done very well, and we're both very happy now that he comes in once every 9 weeks. The second is a 62-year-old woman who presented to me initially for a second opinion for macular edema. And you can see here she's 20/50, significant edema. And this happened several years ago, and I'm a strong believer in protocol T, so I began her on aflibercept 2 milligrams. 5 monthly injections. She's improved to 20/30, 3/4 of the way down the page. And now I go to every 8 weeks, and she still continues to improve visual acuity and remains quite dry, does very well. I said, you're doing really well at 8 weeks, maybe we can go a little bit further. So we go to 10 weeks, and her fluid comes back, and her vision begins to drop. I decided to drop her to 9 weeks, and she did very well. Continued along, treating her every 8 to 9 weeks, and then eventually I said, let's try it again. We go to 11 weeks, and her fluid comes back again. 9 weeks, and once again, she's under control. So again, we've reached this very consistent top-end interval of 9 weeks that this patient gets on aflibercept 2 milligrams. I think most of us would think that's a pretty good treatment. That's a success. But nevertheless, when we look at sustained disease control and extendability with decreased number of injections, we'd love to get better. So finally I get 8 milligrams, and I say, let's go ahead and switch you to 8 milligrams. So now she comes back at 11 weeks, does well, I inject her. Now I'm getting a little bit bolder, because now I go to 3-week adjustment. Come back at 14, then I get bolder yet, and I go to 4-week adjustment at 18, and she's doing well. She's completely dry. She's 20/30 at 18 weeks. The next interval will be at 22 weeks going forward. So I've actually doubled her interval, which is a little bit more than I expect. My rule of thumb with 8 milligrams compared to successful treatment with other drugs is increasing by about 50%. She's actually done better than that, and now we're out at 4.5 months for her treatment. So here you can see our summary that patients doing well, albeit with short intervals, certainly can be extended when switching to 8 milligrams. There is a limit, but we can find that limit quite easily and maintain the same visual acuity that we get on the shorter intervals. Thank you.